Next, we're gonna be doing the cardiovascular assessment. So when I start my cardiovascular assessment, I do just wanna do inspection first with my patient. So I'm gonna have my patient semi-reclined. I want her at about a 45-degree angle. Can you just rest your head back and can you look to the left for me? So I want to observe her neck for any type of possible jugular vein distension, which I do not note. I'm gonna have her turn her head also to the other side. No jugular vein distension noted. I'm also going to inspect the thorax. So I'm looking for color. Ideally, I would have her thorax exposed, but of course we're not going to for this video. So color, I do want to note temperature of my patient and note any sort of lesions that may be on the chest wall. I'm also inspecting for any heaves or lifts, which are precordial impulses that can either be seen or felt. So I am going to rest my hand directly on the chest wall, which I do not note that. Next, I'm going to auscultate with my patient. So I'm going to listen to her carotid arteries first. And I'm gonna do that with the bell side of my stethoscope or the smaller side. So the right carotid and the left carotid. And I do not hear any type of turbulent blood flow, which would be called a bruit. Next, I'm going to listen to my 4 heart valves. I'm also going to listen at Erb's point, which is not a valve position. It is just kind of the central location where I can hear everything the best. I will also auscultate at my apex for a full minute and also palpate my apex as well. So I'm gonna start this off with the diaphragm of my stethoscope or the large round side. I want to identify where my valves are gonna be. So I'm gonna start out with my aortic valve. What I need to do for this, and I'm just gonna pull down lightly here. I want to find her collarbone and I wanna go down to the second intercostal space. So I'm gonna count, that first dip is 1. There's her second rib. So her second intercostal space is going to be right here, and this will be right side, right sternal border. So this is aortic. Directly across is the pulmonic. Next intercostal space down is my Erb's point. Next intercostal space will be my tricuspid. Ideally, again, I would have her exposed, but so for women, it is a little bit harder if they do have bras on, but I can hear there. The next intercostal space down and then mid-clavicular line. So I'm gonna find her clavicle, middle, and I'm going to ask her if I can lift her breast tissue. Okay, so that is the mitral. I'm also going to identify the apex, which is really right about where my mitral valve is at. I am going to palpate. Sorry. Okay, and then I'm going to listen for a full minute. All right, now that I have auscultated with the diaphragm side of my stethoscope, I'm also now going to listen with the bell side of my stethoscope because it is a little easier to identify any murmurs with that. So my second intercostal space, right sternal border will be my aortic. Directly across is the pulmonic. The next space down is Erb's point. The next space down is the tricuspid. And next space down, mid-clavicular line will be my mitral. Okay. And when I'm auscultating, what I'm listening for is the S1, S2, or the lub-dub sound, which I do note. I did not note any murmurs, and I did not know any extra heart sounds like S3 or S4. Her heart rhythm is very regular. I did not know any ectopic beats, and her pulse or beats per minute was around 84 per minute. Once I've auscultated there, I do also want to palpate my carotid arteries. The biggest thing about our carotid arteries is we do not want to palpate those at the same time. So I'm going to palpate her right carotid first. So what I'm gonna do is take my fingers, identify that trachea, and just kind of slide my fingers over into that soft spot between her trachea and this big muscle here. It is 2+. Same thing for the left side. So identify the trachea, slide your fingers just over into that soft spot. And it is 2+ as well. I'm going to assess her brachial arteries, which are gonna be in the bend of the arm, a little more medial or closer to the inside here. So identify the bend of the arm, slide your fingers over. Okay, and I want to palpate the other one at the same time. And those are 2+ and equal. Next, I'm gonna do her radial arteries, which is in the bend of the wrist on the thumb side. Okay, and those are 2+ and equal. I also do want to inspect her arms for symmetry, so I'm checking for any type of edema, and I will actually palpate as well just to make sure there is no pitting or indentations in the skin, which I do not note. Okay, they are equal. No pitting noticed. I'm also going to check capillary refill on both hands. Okay, and that is less than 3 seconds. Next, I'm going to move down to the lower extremities. So again, I do want to expose my lower extremities. I'm assessing for symmetry, and I am going to palpate as well. I do not note any edema or indentations. I'm going to identify my dorsalis pedis pulses, which are on the top aspect of the foot. So I'm going to take my 2 fingers, find the first and second toe, and kind of just draw a V directly down. That should be about where that dorsalis pedis will be. Okay. Those are 2+ and equal. Next, I'm going to identify my posterior tibial pulses, which are going to be the inner aspect of the ankle. So what I want to do is find her ankle bone, and I'm just going to slide my fingers into that indentation between the bone and the Achilles tendon. And compare to the other side. Okay, and those are 2+ and equal as well. I'm also going to check capillary refill. Okay, and that is less than 3 seconds as well. And that concludes the cardiovascular assessment.